massage it like this. So I go climber grip, just tag along, try to do as me. Go with a climber grip like this. You go behind the sternocleidomastoid, find a hook. I can show you. Go behind it like this, hook it like this, and you pull inwards like you're having a bow and arrow. Go in behind, lock it, and you pull like this. Pull with your elbow, pulling with my elbow. It could be painful if you have a stiff neck. So do that like 3-4 times, and then you try your mobility in your neck again. You go to the right side for me, and the other side. How stiff is your neck? This method, where I'm practicing, is the lymphatic treatment. So if you go to another muscle therapist, they are not using the same technique as I, because I'm I'm the founder of lymphatic treatment. It's a new treatment of how you can fix yourself by opening up the smallest passage in the body, like in the muscles, the tendons, and the lymph node. So this is a very unique treatment. Been practicing for 11 years in Norway, and I normally don't have any advertising for getting customers, because I treat like 14-15 people every day. So now I'm gonna go back to how you can fix your stiff neck. So climber's grip, go behind, go like this, and you pull it like that. So the hard part is to go like if you're climbing a rock, you have to go behind it, and you're gonna have a good hold on the rock like this. And I get a hold of it, and I go cross massage it like this. Okay, so if you feel, the other technique I'm gonna show you is the pinching technique. Okay, so you go in like this, pinch, and I pinch it like this. I'm holding the pinch, and I twist it, okay? Holding and twisting it. If you try that, pinch, hold it like this, and you pinch it. Twisting, or pinching. My English is not that good. I hope you understand. There we go. It should be soft when you touch it like this. Should not be hard. Okay, and then go on the other side. You can test the other side like this. Is it painful? And check the other side like that. Okay, so try your chin again. Go to the left side. Is it painful on this side? Go on the other side. Check if it's more mobility like that. Okay. Hey, thank you. A lot of comments there, and yeah. What if I don't have tonsils? Okay, great. So we have people from all over the world following me now, and that's awesome. So I'm going to show you this stiff neck treatment, and now I showed you climber's grip. Go behind and pull the muscle, the sternocleidomastoid, because if this muscle is contracted, it will pull on your back of your neck and pull off on your collarbone. If it's contracted, it will pull on your neck. It could give you pain in your jaw. It could bad circulation to your ear. So we have to also check your chin, your jaw pain. So if you go in like this with your finger on this muscle here, it should be soft and not tender. And this muscle is called the masseter. Okay, we have to cross the masseter like this, or you can use your knuckle. You have to cross massage it like this. It should not be painful. There we go. Pull in and twist it. For some people this is like painful and almost screaming. Go soft then. Try a little bit softer like that. And on the other side, check it. Is it more painful on the one side, on the other side? It should be soft on the touch. I always use my thumb, because I have a strong thumb, making a hook of the thumb like this, go in, and I go behind the jaw. It should not be tender, should not be swollen, because if a swollen lymph node is expanded, and this expanded lymph node will block the drainage for your lymphatic system. So this muscle here, if you open that up and the jaw, you get better circulation to your ear. So I have people that have had tinnitus, and that said to me after doing this they had better circulation to the ear, and it just doesn't have the sound in the ear anymore. I cannot help everyone, but I can help some. So that's awesome. Okay, from Jamaica. Oh, great, and I have helped you. So awesome. High blood pressure. Yeah, the high blood pressure because you have your heart is pumping the blood and cleaning the blood. That's the lymphatic system, draining for garbage. And the virus, if you have a virus in your body, your lymphatic system, your lymphocytes are gonna sniff down the virus, eat the virus, and then they go back to the lymph node and they kill themselves, and then they also kill the virus. So it's a action movie in your body all the time. Defense and attack, defense and attack. So that's awesome. Okay, severe allergies. You helped me with your sinuses. I posted a video. What's your? I'm not a doctor. I'm a muscle therapist and a founder of a new treatment called lymphatic treatment. Okay. Here we go. I'm reading a lot of comments coming in, so I'm reading that and trying to teach people how you can fix yourself. The main reason for this video is to fix your neck and maybe your jaw, and if you fix your jaw and your neck, you get better circulation through your system and your drainage gets better, and you can test your neck, twist it like this, and if it's better, if it's painful in your neck, you have to go climb a grip or use your thumb like this, and you have to twist the muscle. So I go like this with my thumb, and I go like that, twisting it, and then you open up the circulation to your neck. All right, a good question. Menopause. All right. Yeah, I think if you have pain in your body, I think it's a bad regulated fluid flow. So if you have a headache, or you have a stiff neck, or you have a jaw pain, it's all come back to the drainage of your blood. So if your blood is full of lactate acid, then the muscle, which actually is the pump for the fluid flow for your tissue fluid and your lymph fluid, it gets bad fluid flow. And if you got bad fluid flow through your neck up to your head, you get a migraine or a headache. I think that's my theory, and it's not coming from loose air. I have been treating over 20,000 people with a lymphatic treatment, and by opening up where the smallest passage in your body is, the body and the muscles are pumping the fluid faster. Like if your neck muscles are contracted, it's not 100% pumping the lymph and the tissue fluid. So by draining or cross-mastering the neck muscle, you get better pump, better circulation, and you regulate the fluid flow and the garbage in your blood better. So pain on the left side neck. All right, if you have left side, that for me is this side, now we have to check which muscle in your neck is painful. So if it's the levator scapula, is located in your back of your head and on your shoulder blade. So if that is contracted, it will lift up your shoulder like this. So we have to go behind it like this, check it like that, with a climber grip, lock your grip like this, come behind, and you pull it like that. All right. You can also pinch the muscle, pinch it like this. There we go, pinching it. You can see it's quite painful. My neck is quite stiff, I can feel it. There we go. All right. Other questions I can try to answer. There we go. So I get some Norwegian questions and I get some English question. I will try to answer in English. So if you have like shoulder pain or you have neck pain, it's all connected. So if your neck pain, you have a stiff neck, the muscle is contracted and it will pull on your what's the English word? The trapezius, I think it's English. And that's the muscle from the neck down to your shoulder blade, like there. So if you go like this, it's painful. Normally people say, oh, my neck, my neck. Then you can pinch the muscle. So I will open up here and I can show you what you can do. So if this muscle here, if it's painful on a touch, you have to pinch it like this. So go up, go into the muscle like that, and I pinch it. There we go. I'm holding the pinch like this. I can feel it's tender, I feel it's sore, and I hold the pinch and I go up. And it's like, you can feel it. I hold the pinch and I pull upwards. There we go. Okay. And if that muscle is contracted, it will lift the shoulder, and then we can try the shoulder. Okay? So now you learn a lot. I show you stiff neck, your jaw, your neck, your levator scapula, your trapezius, and now your shoulder. So go with the climber grip like this. You go in behind the deltoid, and there we go, climber's grip, and I can rotate my arm. I will show you. So I go in like this, and I rotate my arm, holding the grip, and rotate my arm like that. You should get a hold of the muscle, like you're climbing, holding it like that, and you go like that, okay? It should not, if you pinch the muscle like this, I can show you. Ooh, showing muscles. If I pinch it like this, it should not be tender or sore. So I go climber's grip behind my deltoid like that, holding it, and then I'm showing again, I'm rotating my arm. And you can see I'm holding the grip like I'm climbing, and I'm rotating. There you go. And now you can see when I'm pulling it like this, it's so much softer. So all of the technique I'm showing you is coming from a treatment called lymphatic treatment. And the lymphatic treatment is a Norwegian method of how we can help your body fix yourself. By opening up the smallest passage in your body for the muscles, the tendons, and the lymphatic system. Then you get better garbage drainage, and the body fixes itself better. Okay? Calf injury, okay. It's hard to show calf injury because then I have to go away from the camera. If you want, okay, I have a clinic in Bergen, in Sotra. It's 50 minutes from Bergen in Norway. And you can go, I'm Norwegian, and then you can go into my website, maxliving.no, and you can order an appointment there. When I treat people with lymphatic treatment, and if you have a stiff neck, then I will not only go for the stiff neck, because the stiff neck is the symptom for bad circulation, unregulated circulation, fluid flow to your neck. Then I have to open up the shoulder blade, I have to open up your neck muscles, your shoulder muscles. So a lymphatic treatment is the whole body. I open up full body treatment, so the body and the muscles are pumping the lymph and the tissue fluid better, so it will drain or cleanse your blood easier. Okay. So I'm reading the questions, some questions in Norwegian, some English, and I will answer them in English. So we have out of, okay, scoliosis, ischias, yeah, all right. What I can show you is if you have a sore throat, is in this neck muscles again. If your neck muscles here are contracted, you can feel them if you pinch them like this. If you pinch, okay, I can feel this side is soft because I've been treating this. I can see I'm quite red in this area, but not in this area because I have been using my thumb. So this muscle is now soft, but this is not. So if I have like coughing a lot, we have a lymph node located right here. There is the lymph node. Here we go. And I can feel on this side, it's quite swollen. So I go in like this and I pinch it like that. So it could be like swollen, but if you drain it, there we go. It should be soft when you go like this. Okay, if you have pain in the knee, we have to open up not only the knee, because the knee often is the symptom of your thigh muscles are contracted. And if the thigh muscles is contracted, it will pull on your knee and give you knee pain. You can have a damage in your knee or like a rupture in your meniscus, but often the problem is the fluid flow through your knee. So if your muscles pull, it will give you bad circulation to your knee, and the fluid builds up and gives you knee pain. Ear ringing, travel sickness, head reels. Yeah, if you have like I'm telling, if you have a stiff neck, that's a symptom of bad circulation to your neck, and if it's bad circulation to your neck, it will be bad circulation to your head. So if very often people have stiff neck and migraine or headache, and that's because of the circulation to your head, in my theory. So if you have that, you have to check your jaw. If the masseter muscle here, is it contracted, is it painful? You have to open it up like this, go in behind and pinch it, or use your knuckle, go in behind and I squeeze it like that. There we go. And on this side, use my knuckle like this and I go there. So if these muscles, masseter, is more not so swollen, then it's got better circulation to my cheekbones. And I have to, if your headache is in your forehead like this, you have to open up the lymph node located right here. And now we are like in the sinuses area, because if this lymph node is swollen, it will block the drainage for your sinuses. And not only will block the drainage, it will block the blood and the nerves and the lymphatic system. So if you drain that big lymph node, it's actually two big lymph nodes, they get smaller, and you will regulate the fluid flow to your forehead and to your sinuses, so the fluid flow gets better. So the hard part here, if you go down there, under your cheekbone, you can feel it's tender, you can feel it's painful maybe. So I go in like this, holding it, and I can feel, okay, you can hold it and it will help you. If you want a faster result, you go a little bit deeper, holding the lymph node where it's painful, and then I pull upwards. So I'm pulling upwards like this. There we go. So I'm squeezing the lymph node. It's quite painful, and then the lymph node gets smaller, and circulation to your sinuses, or since it gets smaller, it will not put pressure on your sinuses or your blood or your nerves. So check you both sides like this, going down under your cheekbone like this, holding it. Find the where it's swollen, where it's quite painful, holding the pinch. It will help by holding it if it's too painful to go upwards. And then now I'm actually draining this lymph node. I can feel it. Quite painful. There we go. And now it's so much better. I can feel it gets softer. It's not tender anymore. And then it gets smaller. Okay. And when I have drained these lymph nodes, we have two big lymph nodes. So you can see now my cheeks are red. And if you're doing this, you will get very warm in your face, because now you get better fluid flow to your face, on your tissue fluid and your lymph fluid. And someone can feel like pumping in your face, like the heat is, you get warm in your face, and that's normal. It will go away. And watch my cheeks, they are now red. So that's normal. Okay, we have a lymph node just by your eyebrow, in the start of your eyebrow, like there. We go in here and you open it up. I go in like this and I squeeze it like that. Should feel a little knob, and I open it up. There we go. And on this side, go in and I open it up like this. Ah, there we go. Perfect. One, yeah, that's so pain. Yeah, this one is quite painful, but it should not be painful. So check the other side. The same. There we go. Open up. Squeeze in like this and open up. Okay, so now we have opened up the jaw, the neck, the jaw, the sinuses or the lymph node to your sinuses, the lymph node in your eyebrow here, and now you should have better circulation to your head. I have trapped nerve in neck and whole shoulder, arm down to fingers in agony and numb. Okay, so if you have a numb fingers and hands, then we have to open up on the shoulder, climbers grip like this, go behind the muscle like that, and I rotate my arm. I will show you. Holding the grip, rotate the arm. Normally, when this muscle is contracted, it will block the circulation to your muscles, and the muscles are pumping the garbage through your tissue fluid and your lymph fluid. So we have to drain it like this. And then you have, if you have shoulder pain in this area, is actually the start of your biceps is in this area. So I go like this. If it's painful when you do like this, I need to go down here. It's logic, right? Pain here, and you have to open up here. No, it's not. But we have a muscle here, is brachyradialis in Norwegian. And we have to open that muscle up, because if that muscle is contracted, it will pull on your biceps, and your biceps starts here and is down below here. So we have to go. If you take your arm like this, the highest point on your arm, you go in with your thumb, hook the thumb like this, go in to this muscle there, and I can show you my finger gonna pop. There we go. My finger is popping the finger. There we go. And when the longest finger is popping like that, so I go in, here we go, pinch in, and I twist it like that. And it should be soft. You should be able to pull your skin like this, and if you go with your thumb like that, it should be soft on the touch. And then you can check your shoulder again. It should be better. Should not be painful at all. So, I'm a muscle therapist, and I try to teach you how you can fix yourself. And if this helped you, I will be really, really happy if you liked or shared my video, so I can keep giving good content. I love to share, and if it was up to me, I would only do this, because so many people follow me now. On TikTok, I have to tell a little bit story. Oh, thank you. Because when I started this for 2 years ago, I posted a video every day for 2 years on TikTok, Facebook, Instagram, and now when I started, I had like 2,000 followers, and now I have 412,000 followers, 275 followers on TikTok. And I got a viral video for like 16 days ago. It went really viral, 16 million views, and I got like 180,000 new followers on TikTok for like the past 14 days. So the magic, what I'm teaching, it's the body is able to fix you, but you need to open up where the smallest passage is. So by opening up the smallest passage, the muscles are pumping better again, and it will drain the fluid flow. All right. So I have people coming from Jamaica and Mauritius and all over the place now. So the knowledge that I know, I want to take this to the whole world, because would it be awesome if you can sit at home, fix yourself with the smallest. If you have a headache, if you have a stiff neck, if you have shoulder pain, if you go in early, open up the smallest passage, the body will fix itself easier. If you wait or not moving, because if you're the muscles are pumping the fluid flow, the tissue fluid and the lymph fluid. So if you have pain, by moving, you actually you regulate the fluid flow, and it will drain the muscles better and your blood better. So movement is the best thing to do. I also have different channels. I'm on Instagram and on YouTube. On YouTube, I'm Captain Pain-Free, but I will soon change name there. But Captain Pain-Free in YouTube. On Instagram, I'm Smertefri med Rune. So I'm all over the world now. Online consultation I'll also do, but mainly on shoulder, head, because showing knee pain or like back pain is hard to do one-to-one. Philippines. Yeah, the cheek, the lymph, the drainage for the sinuses. Tingling in the head. Yeah, I'm from Norway, so I'm living in Sotra, 50 minutes from Bergen. I have my own clinic, Max Living. So if you go into maxliving.no, you can learn, you can book an appointment, and soon I will have a new web page where you can actually learn more, and I will have online courses and so on. Because, and of course I do this. How long do you have to massage until stiff neck is over for good? It's not how long, it's about the tension in the muscle. So you have to go for the feel. So you can try by your chin going to this side or the other side. If you feel the muscles are holding you or pulling you, you need to drain it. So you have to cross massage the muscle. Going in with a climber grip like this, going behind and pull it like that. And if you can also pinch it like this, going in, pinching it, holding and twisting it. Then you get better regulation of your fluid flow, and your blood get better drainage. From Iraq. Cool. So all over the world. Your lymph drain of sinus gave me vertigo for 3 days. What did I do wrong? If you got vertigo from draining your sinuses, you have just open up maybe on these lymph nodes. You also have to open up the lymph and the muscles in your jaw, so you get better circulation to your ear. And you also have to go behind your jaw like this, drain that lymph node like this, going in, making a hook with your thumb, go in like this, and I open up like that, and then you get better circulation to your ear. So what you did is you open up one place and the fluid flow gets better, but the pressure builds otherwhere. The next place, the smallest passage, like a river going down, and you have a dam, and then you get bad regulation to your ear, and then you get maybe vertigo. All right. So now we have 30 minutes, and I soon have to go, but I will try to answer some more questions. I love to do this, so I would be very, very happy if I can keep doing this. So please give gifts if you can, and I will keep sharing my content with you. Okay, I will read neck pain. Yeah, you have neck pain. We have to twist it like this. And this. Here we go. Thank you. From Malaysia, that's awesome. Constant pain in your fingers, all right. I have a nice trick for you if you have finger pain or cold fingers. We have to use the table, the edge of your table. You go in like this and you pull your hand over the table like this. I can show you faster now. I can show you. I go like this, here at the edge of the table. I go like this and I pull it. Nice sound, right? I go like this. And then I open up the fascia like this, and you get better drainage. Okay, here we go. The jaw making clicking sounds every time I chew. How do I fix this? All right. Then we have to check this muscle. And this muscle, if it's contracted, it will pull on your jaw and give you bad circulation to your jaw. So you have to go in with your knuckle, go in behind. You can feel the tenderness. Go in behind like this, and I cross it like that. It should not be tender, should not be painful when you do this. So go over, twist it over with your knuckle like 3-4 times. Check if it's better. Go on the other side, check it. So I've been treating myself now, so you can see my cheeks are quite red. And that gives better circulation. So normally not this red, but now it's red because I have treated my cheeks. All right. Any tips for drainage in forearm? In the forearm, we have a lot of muscle when using them all the time. When we are using the phone or so forth. This is the last tip I'm gonna give you because I have appointment people. I'm gonna treat people here today. I have 15 people I'm gonna treat today, and I'm half there, so I have 8 people more I have to treat. But before that, I will show you this nice trick. I will use my thumb like that. I go in with my thumb like this, and I can show you. There we go. Pull it in like this. Oh, how can I show this? Here we go. So I go in like this, and I twist it like that. You can see my fingers. There we go. Fingers are popping because this is the strings or the tendons to your fingers. Here we go. So if you have a golfer's elbow, tennis elbow, or overuse these muscles, which we do because we sit on office and so forth, we have to drain them. Here we go, draining them like this. And I'm pulling. It's so much softer now. Yeah, it's painful. It should not be painful. Should be soft and not painful at all. And on this side, we go in, and I go in twisting it like this, and it should not be painful. It should be soft. So go deep and twist it like that. Not overdo, should not be. The brain will stop you. So if your brain says, no, 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 don't do it. Go softer then. Go softer, little bit tingling there. There we go. Hello from Scotland. Yeah, hello Scotland. Okay. That was today's show. I hope you learned a lot. I will try keeping maybe every week I will come back to you so you can learn even more. And practice make perfect, they say. So I have practicing treating myself the last 10 years. So you have to try and practice, and you can feel when you get better. So by pinching, the neck should not be painful. Try it, pull sometimes, check your chin again, should not be painful. Okay, thank you from Mexico, thank you for Norway. This was awesome. This gave me a lot of energy, and now I'm very happy that so many people watch this show. Okay, thank you. Bye bye.